Nowadays, most of the companies are providing work from home opportunities for inpatient coders. Usually, we will call them as IPDRG coders. So, many coders are trying for these work from home jobs, but they don't know how to clear an inpatient coding interview. In order to help those coders who wants to have work from home job, I am creating this video. Here we are going to see nearly 25 Q&A related to latest inpatient coding interviews. First question is, what is the main purpose of DRG? The main purpose is to determine hospital reimbursement for inpatient services under fixed payment system. So basically, in inpatient coding, we have DRG. So based on DRG only, hospital will get the amount. So what is the full form of DRG? Diagnosis related group. So here in DRG concept, few diagnoses will combine and they will form one group. Under those group, we have number of ICD-10 codes. Next, what coding systems are used to assign DRG? So basically, what are the types of codes we will use to assign DRG? In inpatient coding, we will use ICD-10 for diagnosis code, ICD-10 PCS for procedure codes. Based on these two coding system, hospital will get the payment. Because of this reason, for inpatient coders, DRG plays a very important role. Because of this DRG, hospital will get the payment. Next, what is IPDRG? So basically, if you expand this IPDRG, inpatient diagnosis related groups is a hospital payment classification which is used to group inpatient hospital cases based on diagnosis, procedures, age, discharge status, and complications. So basically, this DRG depends on few factors. Okay, if you want to calculate DRG, these all factors are mandatory. So what are those? Patient's diagnosis mandatory. If the patient performs procedure, that is also mandatory. Patient's age mandatory. Discharge status mandatory, as well as complications occurred during the inpatient stay mandatory, as well as CC, MCC also mandatory in order to get appropriate DRG. So if anyone looking for medical coding jobs in UAE, USA and India, please join in WhatsApp group. Group link is in the description of this video. And also if anyone looking for same-day surgery training, IPDRG training, SCC training, CCA certification training, please send WhatsApp message to 707-526-3939. Next, most of the inpatient coders will use MSDRG. So basically what is this MSDRG? So Medicare Severity Diagnosis Related Group. Okay, so mostly we will use this MSDRG for CMS, Center for Medicare and Medicaid Services, which consider severity of illness. So if you see MSDRG, we will use for CMS or Medicare patients or Medicaid patient. So what is secondary diagnosis? So secondary diagnosis in additional condition that affects patient care during hospitalization. Okay, so basically this secondary diagnosis is very important for inpatient coders as well as outpatient coders, as the secondary diagnosis will affect the patient's current care. Okay, what are the three DRG severity levels? So we have three DRG levels, like without CC, MCC, with CC and with MCC. So what is CC here? Complication, comorbidity. What is MCC? Major complication and comorbidity. These are the DRG severity levels. Next, what is principal diagnosis? So principal diagnosis is the condition primarily responsible for the patient admission to the hospital. So because of this principal diagnosis only, patient will get admitted to the hospital. So based on this principal diagnosis, hospitals will get the DRG payment. So previously we have seen MCC, correct? So basically what is MCC? So MCC means major complication or comorbidity. which indicates a severe condition that increases hospital resource use. Okay. So if the patient is having MCC, so hospital needs to put more resources in order to cure patient's condition. Okay. So that is MCC. So what are the most common examples for MCC? Acute respiratory failure as well as septic shock. If the patient is having these two conditions during the inpatient stay, hospital needs to put more resources. So this DRG payment will be more higher than the without DRG or without MCC or CC. Next, what is CC? So like MCC, we have CC also. CC means complication or comorbidity that requires additional treatment but is less severe than MCC. So what are the most common examples for MCC? Dehydration and mild infection. So these are CC condition, not MCCs. What is next one? Which organization developed DRG? So basically, initially, DRG was developed by Yale University Research, Robert Petter and Robert Thompson. Next, what is DRG Grouper? So DRG Grouper is a software that assigns DRG codes automatically based on diagnosis, procedures, and patient data. In CMS also, we have one free DRG Grouper. If you want to know that DRG Grouper, how to use it, please mention in the comment section of this video. Which is free, you can use this DRG Grouper freely. What affects DRG assignment? As we have discussed previously, DRG will be affected by principal diagnosis, secondary diagnosis, procedure performed, patient CAs, as well as discharge status. Next, what is MDC? So, major diagnostic category is a grouping of DRGs based on body systems or diseases. So, we have different types of MDCs. These will be based on body systems or diseases. So, for example, if you see MDC 4, respiratory system conditions, MDC 5, you will see all circulatory system DRGs. What is case mix index? So usually we will call it as CMI. So case mix index measures the complexity and severity of patient's treatment in a hospital. So higher CMI is equal higher hospital reimbursement or vice versa. This is very important for your interview, case mix index. Next, what is DRG reimbursement? So basically, as we have discussed previously, hospitals will receive fixed payment amount per DRG, regardless of the actual cost of treatment. Next, what is the difference between APC and DRG? So DRG APC used for inpatient services, used for outpatient services. Okay. So basically, DRG is used for inpatient, APC is used for outpatient. So next one, why is accurate coding important DRG? So as we have discussed, for correct hospital payment, accurate DRG required. Compliance with regulations, accurate DRG required. Proper patient data reporting, accurate